Hello, everybody. I am so excited to be here tonight. I've been waiting for this day for a really long time, actually. We've been talking about doing this for a long time. I'm here with my dear friend, Dr. Nalini Chilkov. She is a specialist in integrative approaches to cancer therapy, and she's a licensed acupuncturist, and she works really well with helping people to overcome their to really live well. She'll talk all about it with their cancer, whether it be getting rid of it or whether it be just, living a long and healthy life in spite of it because of all the other things you're doing. It's an important thing to know. And you guys as health practitioners are going to have a lot of people who have either had cancer, have cancer, or want to prevent cancer. And you want to be prepared for that. You don't want to put yourself out there as a cancer specialist or a cancer that you treat cancer, because it's pretty illegal to treat cancer unless you're an oncologist. But there are things that you need to learn about the disease and about how to work with people who are either at risk, have had it before and don't want to get it again, or even currently have it, and you're going to work with their healthcare team. So I'm just so thrilled and delighted to have you meet Dr. Nalini Chilkov. Hello, Dr. Nalini.
Hello, my dear. Thank you so much for having me.
I'm excited. We've been talking about this. It's been probably a couple of years, right?
Yep. Here we are.
And it's like, okay, when are we going to do this? And now we're here. I'm so excited. She is recognized as a leading cancer specialist, expert as in the knowledge of an integrative approach to cancer. She's been featured on NBC TV. She has an amazing book, and she's been on WebMD and Dr. Oz's sharecare.com. So she's getting around. She speaks at conferences all the time because I can never catch her because she's always flitting off to Europe or wherever they're asking her to come and speak. She speaks to doctors. She speaks to health coaches. She speaks to whoever is excited about this approach. And she actually teaches a training program where she has MDs and nurses and health coaches and dietitians and nutritionists come and take that course so that they can learn this more integrative approach to cancer. So I'm just so excited that you have found time in that busy speaking schedule to be here with our audience.
I'm excited too.
Oh, yeah. And you also have been acknowledged in Suzanne, she's not a doctor, Suzanne Summers' book, Knockout Doctors Who Are Curing Cancer and How to Prevent Getting It in the First Place. So you've been around the block, and she's the founder of the American Institute of Integrative Oncology. And it's really there, like I said, to empower the health professionals who are right in the front lines working with people. And she's people all over the world. And she's just doing an amazing service for these doctors, for their patients, and for the family members. So thank you and welcome again.
Thanks.
So I'd love to start with, you talk about having a plan for health rather than a plan for disease. Like, people want to get rid of their disease. So how do I kill the disease? How do I get rid of the disease? But you talk more about having a plan for health. So tell me more about that. Tell our audience more about that.
Well, I think that ultimately, what does a patient want? The patient wants to have robust health and longevity and not be a cancer patient, whereas the oncologist is really the disease expert who's fascinated by cancer, but has no plan for your health during your care, or helping you recover, or helping you not have a recurrence. Or if you come from a family with high risk, how do you create a body where cancer cannot thrive? And so if there's no health model, we can't get to health.
That's right. That's right. And that's what I believe, and I keep talking about all the time, and I'm sure you agree based on what I know about you, is that we don't have a healthcare system right now. No. We have a disease management system.
Right.
And they're great at handling acute illness and injuries and trauma and those things that require immediate life-saving measures. But we're failing very, very big time in those chronic things like, cancer, which is not an acute illness. I don't believe it is. It's more of something that's built up over years and years and years. Cancer, diabetes, heart disease, these are all things that might kill somebody quickly or seem to come on quickly. Mm-hmm. But it comes from not having a health plan, right?
Well, I want to respond to something, because the oncologist makes the patient feel like you just got an emergency diagnosis, but cancer is not an urgent care diagnosis. Cancer is a chronic illness that has been forming for 10 or 20 years by the time you find it. And so but the oncologist says, if you don't start next week, you won't survive. And so part of our job as clinicians and what patients really need to know is that take your time, get as many opinions as you need to feel comfortable with the decision you're making, be an educated patient, take the time to get your family in order, your business in order, your psyche caught up to your new reality, so that when you have made a plan, hopefully with a team that has a health expert and your oncology team,
Right.
that then you feel like you have some control over what's going to come next.
Absolutely. That is such a great comment. I totally agree with that. And because what they do a lot of times is they actually can make it worse, right? Because they instill a new factor, which is fear, right? The person had a little lump or a bump, or they weren't feeling so hot. They go to the doctor and now suddenly they're terrified for their life. And they feel like they have to make a decision right away. And fear, we know, creates cortisol, creates stress, creates insulin resistance and all sorts of stuff. So actually that attitude is actually feeding it. Am I?
Yes. And, most specialists don't have a lot of training in patient interaction skills. Some are better than others because of who they are. But I feel, let's talk about what we can do if a patient calls us and says, I was just diagnosed with cancer, or I'm in the middle of treatment and I'm suffering, or I'm done with treatment and I'm feeling lousy. So our job, especially at the beginning, is to say, take a few breaths, slow down, take some time. We got this. We are going to make sure that you have the resilience and the strength and the stamina to deal with what's before you. And we're going to have a plan to give you a foundation of health all the way through. And that just shifts the conversation, but also the feeling of the patient, and to give them tools and to give them something that's life-giving to do also.
Exactly. I love that. I love that.
Yeah.
So how can we, as health providers, whether we're doctors, nurses, health coaches, nutritionists, how can we be supportive if they do decide they're going to go through with the chemo, the radiation, the surgery, whatever, if that seems to be their best decision, how do we actually support them to enhance that process?
Well, I'm very much about being a team player and a bridge builder. And so a lot of my referrals, because I've been in practice 35 years, come from oncologists and surgeons and radiologists and their physician team. And that's what I want to train other clinicians to be, that trusted expert who will work with, not against. And so if I say to the oncologist, you can do the disease part, I'm doing the health part because you're not doing that, then it kind of diffuses some of the resistance. And then as a physician shares patients with you and gets to know you because you're well trained and you do know what you're doing, then they're more comfortable. And then the patient gets such better care and more resources. So building that bridge and being collaborative, I think is really important. And there's some polarization that goes on between natural medicine and conventional medicine. But the patient does better if they have all the tools available to them. And so I always ask, I'm a pragmatist. What's the best tool for the job? What do we need to do here so that you get to see your grandchildren grow up?
Exactly.
Right? Not what do we prefer, right?
No. Yeah. That's not always the same. Of course, we prefer not to have any interventions and to just keep going on and living life the way we've been living it. But that's not always the option. And it's great to have a healthcare team who's versed in both sides and can help make that right decision.
And also, to answer your question more specifically, there's a shortage of oncologists, and there's a huge rising tide of cancer patients because baby boomers are at the age where they're high risk and we're the biggest part of the population. And so most patients are just going to see an oncology nurse and not see the oncologist. And so if the patient can't advocate for themselves to have highly individualized, personalized care, then they're just going to get cookbook care.
Yeah.
And so that's part of our job, to help the patient understand how to get individualized care, how to get really thoughtful planning for them, really thoughtful management and adjusting. And patients need to know what they can ask for. So that's part of our job, is to help them navigate that journey, as well as give them the diet, the supplements, the herbs, the help with their sleep or their pain, that do the parts the oncologist's not doing.
Right. That real care. We have in our program, we have an oncology nurse, and she's been very frustrated with the patients are always asking, what can I do? What can I eat now that I've gotten this diagnosis? And they're going through, she's in infusion. So she's given them infusions and whatnot. And she was feeling helpless. And that's when she joined the program.
Well, that's a group of clinicians that are hungry for this knowledge.
They want
to have face-to-face frontline contact with patients and should have good answers to these questions.
Absolutely.
So I'm delighted to have oncology nurses be interested in this and feel on solid ground with their answers, feel confident that they can really answer the question with skill and knowledge.
Skill, right? Not just randomly, eat good food, eat lots of veggies, really getting into what they need. Yeah. Right. We see them all. Everybody's working towards treating the cancer, getting rid of the cancer. I really like Dr. Tom Lodi's site. He calls it "Stop Making Cancer." Right? Yeah, I love that.
Yeah.
But what seems to happen is that people, once they've had cancer, and they may have gone through the conventional treatment or not, maybe they've done some other alternative route, but nobody's there supporting them in that. What do you do after the fact? Right?
That's right. So this is really where we can have the greatest impact in our services. Some oncologists are very controlling and the patient is told to do nothing. And so sometimes we can't do a lot besides help them with their diet. And I put a therapeutic shake into the plan so that they have really nutrient density going through their treatment. But really, when a patient is done with the oncology care, they feel often like they're dropped off the edge of a cliff because they've had all this intense contact with their care providers. And all of a sudden they say, done, bye, we hope you don't get a recurrence. But at that juncture, number one, the patient is ripe to make change and learn and implement. They feel lousy and they're worried about a recurrence. Everyone who's ever been through that is worried about a recurrence. So if we give them a toolbox, a plan, my Outsmart Cancer plan is just that. How do you create a physiology that's not hospitable to the development, the progression, or the recurrence of cancer? And so you have to have a plan for that. And I have a system for that. And all of the niches in a treatment plan that have to be in there. And then how do you individualize that for the patient in front of you? And it's not hard to do. You just need the pieces. But that's what the patient needs. And imagine the decrease in anxiety for that patient, knowing they have a plan.
Right. And, as I hear you say that, I think, well, it takes away some of their anxiety, because some of the anxiety is, say I'm a mom, right? And I have daughters, or say it's breast cancer, I have children. And like, how do I prevent my kids from going through what I went through? I have a sister, I have an aunt. How do I help them? So that plan is helping them to give good advice to their make a good example for their relatives, right? Their relatives that don't want to go through the same pain as they did, but also how do you support your body so it can handle this tough intervention if you're going through chemo or whatever. And then, of course, none of them want a recurrence. Who wants to go through that again?
That's right. So what I say to patients to motivate them, as I said, so here I'm going to ask you to do some hard things, but that's so we never have the cancer conversation again. Right. And they're okay. I'm in.
And they're okay on that. Right.
But I want to say, the reason I got into this is both my parents had more than one episode of cancer in their lifetimes. They were both diagnosed in their 50s. My mom died at 88. My dad died at 90, not of cancer. Okay. Not of cancer. And so I'm in my 60s now and I have never had cancer. And so I really got into it because I could see that my own genetics and my own family history put me at risk. And so then I said, how do I turn off those cancer promoter genes? And how do I turn on the cancer suppressor genes so that I don't live out my genetic potential?
Right. It's funny because we often hear it said, I want to live out my genetic potential. And I'm like, don't wish it on you until you know what your genetic potential is. I don't want to live out my genetic potential. I want to live out the potential that epigenetically I can modify. Right. And that's what you're talking about.
Exactly. And that's why some of the tools of natural medicine, botanical medicine, and nutraceuticals, molecules from nature, are inherently multitaskers, but many of them, especially the deeply pigmented foods and the pigments in some herbs that are berries like hawthorn berry or schizandra berry, those pigments actually enter the nucleus of the cell and are transcription factors that turn genes on and off. So that's why it matters, right? It matters what you eat and the botanicals you use.
Absolutely. And those are great herbs because people don't usually use them. They may get a tincture of schizandra berry for adrenal stress or hawthorn for their heart, but that's all they've heard, right? And so you're looking at this is the food value of these foods as medicines to actually affect the genes.
Yeah.
And I love that. And they're easy to incorporate, right? You can do it as a tincture, but you can also blend them up and put them into smoothies or soak them up and put them into desserts or whatever else. So you don't have to deprive yourself. Yeah, I love that. Because I'm a big fan of food as medicine, right?
Yes.
And that's what we're talking about here. So there are some things, and you already mentioned food, you already mentioned herbs. So what other things in the toolbox are needed?
Well, number one, I'm an acupuncturist, so I always do acupuncture on my patients who live in Los Angeles, but I treat people all over the world. So
how do you do that with acupuncture? We hear that one.
Right. So, but I encourage them to seek good care, acupuncture care, because acupuncture, for example, is really great for ramping up your immunity and dealing with some of the side effects, such as pain and neuropathy and sleep and hot flashes, and can raise your cell counts when the chemo depresses them. So I want clinicians who go through the course at least to know about it as a resource, because there's a lot of good, really good research. But one of the really big pieces that often is not included is the use of adaptogenic herbs, so that we really are helping the patient to deal with the inherent stress of this journey that is a long journey. And so I'm very, very much into including some good stress management and the gold of tonic herbs from Chinese medicine. So I teach about those, and that really helps a person be more resilient. A lot of people can't finish their oncology care that is actually reducing their tumor because of the side effects. Mm-hmm. So most of my patients can actually go through their whole treatment with few side effects, feel well, and get the most tumor reduction possible. Because as soon as you have a tumor mass, the first job is to reduce that. And so you have to decide how that's going to happen. Could be surgery, it could be chemo, it could be spiritual healing, it could be radiotherapy, but that's the first job. And so while that's happening, what are we going to do to support that good outcome? And how are we going to help the person with their stress going through that? And how are we going to manage the side effects so that we have a health model during what might be a stressful or toxic treatment? It's one of the greatest things that we can do.
Yeah, absolutely. So you mentioned adaptogenic herbs. I'm just curious if you have your top one or two or three.
Well, here's the thing. When you think about botanic medicine, it's a big toolbox. It's a giant toolbox. Mm-hmm. So I always want to pick multitaskers. So if we pick an adaptogen, I want it to have anti-tumor activity also. Or if I pick an adaptogen, I want it to have immune modulating activity. Right. So an example would be ashwagandha, right? Withania, which the withanolides in that plant have anti-tumor activity, but we also know it's a great adaptogen for that tired, wired kind of feeling, which cancer patients really experience. They're really anxious, but they can't relax and rest, right? So that's an example of multitasking. Another example is Panax ginseng and also American ginseng. A lot of people don't know that the ginsengs not only are great for stress, but they have anti-tumor activity. They have blood sugar regulating activity. They have anti-inflammatory activity. So I want to always pick multitaskers, but I also want to pick things that have solid research behind it, because I'm training physicians and I have to be able to defend everything I recommend with good studies, right? Not about mice, but about humans, right? Yeah. So I make an effort that everything that we learn in the course is, you could defend it to your board,
Exactly. I love that. I love that. And then the other thing I wanted to say is you're saying that you keep talking about, working with them, with their oncologist or whatever during the care.
Yes.
Are there cases where people, it's caught early enough, whatever, that they don't need to, that natural medicine can help them without having to go through that?
So everybody's different. So I think about it this way. Every tumor cell line is unique, and the person that is occurring in is unique. So I think that every single cancer episode is its own unique reality. And so it also depends who someone is. But if you have early stage cancer, still, if you have a mass, you should have it removed. Like if you have a small lump in your breast, you'll do a lot better if you have that little tiny lump removed, because then there's no work for your immune system to do on that. Takes the burden off the immune system. But it also means there's no cells there that can swim away, travel, and metastasize. So reducing the number of tumor cells, if you have options for that, you want to do that first. But part of our role is helping patients make good decisions. So I have many oncologists refer patients to me, have declined all care in the conventional oncology setting, who want to talk to me about what are all their choices, right? So that their oncologist presented them with choices. I can help them say, okay, these other options are available. Our goals are still the same, right? We're still going to get to that same place where you don't have risk of progression or recurrence. And so we have to decide with every single person, the earlier you're diagnosed, the more choices you get.
Right. Absolutely. And so people who ignore it, like, oh, there's a lump there, I'm just not going to go get it checked out, I don't want to know what it is, I'm just going to meditate on it, can be putting themselves at risk. And maybe their meditation and their spiritual healing can do it. I mean, I'm not debating that, but it's just the earlier you actually know,
That's right. That's right.
Easier, whether natural or oncological.
Yeah. And we want the most known. So we don't want to ever be guessing. So I actually had a naturopathic doctor come to me who had a lump in her breast. And she said, I want you to treat me. And I said, treat what? I don't know what that lump is, right? Mm-hmm. And I said, well, I think you should have a biopsy so we can look at the cells and know what they are. And she goes, I don't want to have a biopsy. I said, well, I think you ought to have one. So I convinced her to do that. And we then knew what kind of breast cancer she had so that we could decide what to do. Right.
Exactly. Right.
And so that's how you get peace of mind. Yeah. By not guessing,
Exactly. Yeah. Yeah.
And so she never had chemo. She never had radiation. She decided to have a unique therapy where instead of having surgery for that little lump, she got cryotherapy where it was frozen. And freezing therapies are done in Japan a lot. Oh, right. And outside the United States, that's a common therapy for some smaller lesions. But you have to remember, if you have a mass that's the size of a head of a pin, you have 1 billion cells. Right? So the chance that some of them will get into the bloodstream or the lymphatic circulation and travel to another part of your body is not small, even when you have stage 1. So you can't be cavalier. You want to have a plan. You want to have a plan that's solid. And so when you have something like that, you have other options outside of conventional oncology, but you need to make a really educated decision so that if you have children, you do see them grow up. Right.
Got it. Yeah, of course. Of course, that's what we all want. Can I ask you one specific clinical question?
Yes.
We hear a lot about black salve for treatment. I'm sure you hear it too. You can put it on a skin cancer thing. It can fall off. It can also make a big hole and, whatever. I've heard of people putting it on breast cancer. So work with that at all? Is that a valid?
So here's where I stand. I'm pretty conservative. And so I don't like to experiment on my patients. They might want to experiment on themselves, but I would never do that by itself. It only has pretty superficial effects. It's actually a very caustic, irritating kind of a treatment. And so it kind of burns away the tissue underneath it. But how do we know we got all the cells? How do we know if we got all the cells or not? So I would rather do something where we have more certainty. And so if you have other choices besides that, like a small surgery, I think that's more certain.
Mm-hmm.
And then you're not really damaging tissue you don't need to damage.
Got it.
It just because it's natural doesn't mean it doesn't have a downside, right?
Yeah. Oh, yeah, absolutely.
Yeah.
All right. So, there are a couple of other things. So, and I know you had some slides you wanted to
Yeah,
share.
I do. I have some slides that goes through this whole thing.
Okay.
So you let me know when you want to do that.
Yeah. So you've mentioned a couple of times a course, and I know you were working hard over the last year and a half to put together a course for practitioners. How would you empower these people who are listening, whether they're MDs or oncology nurses or health coaches, to go forth and learn more? Like how do you recommend?
Well, I have a course that we'll give you a little sneak peek tour of. Do you want to go through my slides right
Sure,
now?
that would be great.
So there's a link that is the name of my institute. So it's www.aiiore.com/Ritamarie. But they could see it on the slide. That might be easier.
Yeah. Put it up on the slide. And
do you want to do that?
Put it in the chat on the Facebook Live.
Okay.
They could see it
there.
So
let me see if I can get my screen going.
And this will give you copies of it. I know that whenever I do presentations, I hear people, can I have a copy of your slides?
Yeah. All right. So let me play the slideshow here.
Yeah.
Okay. All right. So what we want to do is transform the face of cancer care, but make it personal. Individualized care is how you get the best results no matter what. So we want to ask this core question: what happens if from the moment of diagnosis, you have a health plan along with your disease plan? So you know what you're going to do for exercise. You know how you're going to deal with stress and sleep and what you're going to eat and what herbs you're going to take. And these are all the common questions that you ask at the beginning if you're diagnosed. Instead of having a patient feeling like their hair just got caught on fire and they're just anxious and at the effect of the oncologist. So we want to offer them something else. The reason that this is so important is that by the year 2024, in the United States alone, there's going to be 19 million cancer survivors. So what does that mean? 1 in 2 people in the United States will have a cancer diagnosis in their lifetime. Similar statistics in Canada and Europe and modern countries. But 40% of those people, actually 2/3 of those people, will survive their cancer. And today, 40% of all cancer survivors have been alive for 10 years or more, and nobody's managing their health. Who's managing their health? So they need to know about us. They need to know that there's resources with people who have expertise that can really help them. And a lot of these people live with long-term side effects like chemo brain, cognitive impairment, long-term nerve damage and neuropathies, long-term sleep disorders, long-term imbalances in their gut. So we have the toolbox for that stage of the journey. Now, if you never really studied oncology and you're a primary care frontline kind of clinician, you never learned about this. You don't know. What did you learn about caring for the unique needs of cancer patients and cancer survivors? My knowledge was so general. I sort of knew, well, I should keep the gut healthy and I should keep their blood sugar good and I should help their inflammation. But that is not skillful care. That's real general kind of care.
Yeah.
So that's what motivated me to take a deep dive. And so I think a lot of clinicians, most of the clinicians in my course have been in practice 15, 20 years and are feeling the pain of not having this kind of ground to stand on. So here's how I think about it. Every phase of the journey has its unique needs. If you're just diagnosed, you have certain things on your plate to deal with, certain needs, certain focus. Once you're in treatment, you have a whole nother set of issues that you're dealing with that require an adjustment in your treatment plan, in your care plan. When you're done with treatment, then you have another set of issues and visions for yourself as a patient. And we need to understand the really long-term side effects and how to manage those. But hopefully we have a patient who has no evidence of disease when they're done and they have life beyond cancer if they have a plan for that to be sustainable, because there's always microscopic cancer cells. And this is what the oncologist doesn't tell the patient. The patient knows this. It shouldn't instill fear. It should instill, oh, I'm going to take control of that the way I'd take control of diabetes or the way I'd take control of high blood pressure. I'm going to handle that so that it doesn't do anything. And so that's very important. We're the ones that are going to teach patients how to do that. But there's this huge population of patients that really needs us. And these are this just large growing number of people that are living with cancer as a chronic illness, right? So these might be long-term breast cancer survivors who are on hormonal therapy, or they just might be patients who got a partial response from their treatment, but the cancer isn't doing anything. And so they're living with that, but they're frightened that it's going to, spark again. And so I have a patient like that. He had giant tumor in his abdomen. He had a sarcoma, which is hard to treat. And he was told he was not treatable. He lives in the Midwest. He was given my name by our friend, Tom O'Brien. And he called me from Chicago, and I put him together with a sarcoma specialist here who did extra individualized care on him. He had his tumor removed, and he was expected to not be alive right now. And he has small amount of tumor cells, but they're really slow growing, and we have taken control of it. Right. He's an athlete. He's a marathon runner, and he's doing his life, right? So we can give people back this feeling and this reality. So what we can do is we can really transform outcomes. We can transform prognosis. We can enhance the treatments. We can manage the short-term adverse effects while they're undergoing treatment. But even more important, oncologists do nothing for patients who have long-term effects. I have patients who come to me 8 years, 10 years after their treatment. I still have neuropathy. I still have pain. My brain never recovered from my chemo. So we need to help these people. We have so many tools to do that. But the umbrella for that is providing a health model all the way through, right? So this is a quote from one of my mentors. I tell my patients, I think of cancer as a weed. Modern oncology is focused on destroying the weed, while integrative oncology concentrates on the soil the weed grows in, right? So that's how I explain it to patients. Actually, anybody can get that metaphor, right? Yes. And then once you get that, you understand what we mean by the cancer terrain or the tumor microenvironment. This is largely ignored by oncologists today. So they're focused on the tumor, right? But what about the physiology, the soil in which those cells are arising? If we take control of all that signaling and messaging and the inflammation that's there, the hypercoagulation that's there, the blood sugar and insulin that's there, signaling growth, then we have this whole other layer. And that's why the outcomes are different. That's exactly why the outcomes are different. So I have a system called the Outsmart Cancer System that's about creating this environment where cancer does not thrive. And we want to have a plan to fight the tumor, but we have to nourish the patient. We have to nourish immunity. We have to make sure they have good wound healing after surgery. We have to make sure they sleep. So we have all these things we tend to. So we're going to get to a sneak peek of the course shortly. And here's the link to get the slides for this course and to also get a special gift. But let's talk about a patient of mine just to kind of get this picture. I had a patient who came to me, was also referred to me by one of our colleagues, Dr. Suzanne Bennett, and I share this patient. And she had an untreatable cancer. She also had, she had a uterine cancer that was not treatable by any of the conventional oncology therapies. And she had surgery. She had a hysterectomy to remove most of the mass, but she came to me when it recurred. And she couldn't have surgery again because the recurrence was wrapped around important blood vessels and nerves. So she wasn't even a candidate for surgery. So we had to do something about that. And so what we did is we go into understanding what are called the hallmarks of cancer. And all this are what are the characteristics of tumor cells that allow them to survive, that allow them to keep growing, that allow them to travel and metastasize. If you understand this wheel, then you can decide what herbs to use and what supplements to use and what kind of diet they should be on. And this wheel is also used by oncologists to figure out the best treatments for their patients. So if you get this, you can do so much. So once you get that piece, then you have to have a system. And this is the cancer terrain. This is, what am I going to do about the soil in this garden? And so when I make a treatment plan, I go around this wheel, like all these spokes on this wheel. I go, have I handled the inflammation? Do I know what's going on with them hormonally? Is there angiogenesis, new blood supply being brought to the tumor? How can I deal with that? Is the patient have high blood clotting, which happens in 80% of all tumors and cancers? Most 40% of patients who have cancer die of a blood clot, not of their cancer, right? And so we go around this wheel and look at all the things we can impact. So literally in my mind, when I'm making a treatment plan, I'm going around, do I have that niche filled? Do I have that filled? Do I have that filled? And you don't have to have different things for every spoke. I teach a handful of interventions that are multitasker, right? That can handle many of these things at once. And so with this patient, what we did is we did some biomarkers testing. We did some blood tests on her. We identified the factors that were driving her cancer in the environment, in the soil, and we put a plan together to move those into a healthy realm, right? So that's the system. And so we gave her a very specific diet. All the diets have a lot of colorful pigments in them, but they should be anti-inflammatory. They should be low glycemic, low carbohydrate. They should nourish the microbiome and healthy ecology in the gut. But we have to target things. So we have special diets for different cancers. We gave her very specific nutraceuticals and botanicals, some isolated phytochemicals that, for example, resveratrol or curcumin can be used in like pharmacologic doses, not a nutritional dose, right? A pharmacologic dose to move the needle, to change that physiology. And of course, functional foods and a shake. Oops. And then I spoke about Chinese herbs already, when they're really great tonic and adaptogen qualities. But in modern China today, there's so much research on herbs and cancer. It's a real wealth. We mentioned acupuncture already, but here's the big idea. We want our patients to be outliers. We don't want them to be under the bell curve. We don't want them to have the usual path and course of prognosis. We want them to defy the odds. So I say that to patients when they walk in my office. I say, you're going to be an outlier. Just by walking in my door, you have a new toolbox, a new framework. You're going to have a different journey than patients who don't do this, right? So that's why I'm so passionate about getting frontline clinicians to get this knowledge base and skill set, because you know what? All these people are already in our offices. They're already in our practices. You have patients who are cancer survivors, who are at risk for cancer, who might actually be long-term survivors. And you didn't know that because that wasn't part of the services you provide. But I will tell you something, as soon as anyone in your community knows that you have this knowledge base and skill set, you are going to have a waiting list practice. I have so many more patients calling me than I can see right away. And that's why I also am on a mission to actually teach skills, because this is too big and we really need to be able to serve these patients. So here's your sneak peek. So I'll go through what's in the inner bowels of the course. And I first want to say it's delivered online, so you can learn anywhere, anytime. You don't have to travel to do this. You can do it on your own pace as you wish. So that's the first piece. So when you open up the course, you will see on the left here, you'll see there's 8 main modules, and you can go through them systematically. I teach it in a very systematic way, but let's say there's something in module 7 you need right now. You get the whole course all at once. It's not dripped to you. And so then you start to have this health model. You start to have a framework. You start to know enough about cancer biology and physiology and the tumor microenvironment to make decisions about what your patient should do. And then you get some confidence in it. And then when you click on one of the modules, of the 8 modules, there's several lectures inside every module. And you'll see a screen like this where there's a video and there's my lecture slides. And at the same time, if you want, you can download a PDF that has all of the slides on it. You can take notes. You can also download an audio MP3 if you want to listen to it again, or while you're cooking, or while you're exercising and in your car, whatever. But then also every module has a study guide, because these lectures are really information dense, and a lot of it's new information. And so we give an outline of the lecture, all the main bullet points. If there's some good teaching images to enhance your learning and lock this in for you, and then the references that I use that go with this particular lecture. And so that's very valuable, kind of cheat sheet. But the very best part of the course, I think that I enjoy the most, and I think most of the students enjoy, are the Grand Rounds live calls with me that we do once a month. So you can submit questions, you can submit a case study, get live mentoring with me, go over those. But I also teach a clinical pearl every single month. So I'll do a little mini lecture so that you can keep enhancing your knowledge. Maybe I'll teach something more advanced. Maybe I will update you on research, or we'll learn something you can do diagnostically. For instance, if you're looking at a complete blood count, how will that tell you about the risk your patient has? Something you look at all the time, right? And those are recorded if you can't attend them live. And so that's a deep dive into the course. So we are just really trying to get patients to have clinicians that are experts and can restore and protect their health. Let the oncologist treat the cancer and be the disease expert, but really we can be that health expert, that resource person in our communities that people's loved ones, their coworkers, their friends are searching on the internet for things. And it's so overwhelming just to have one person who has expertise to sort that all out and help patients know what to do, what not to do. It's huge. It's absolutely huge. So we wanted to, number one, give everyone listening a copy of these slides, and this link, www.aiore.com/Ritamarie slides. And then once you get the slides, if you want to hear a clinical pearl, then we'll give you that also, so that you can hear the level of instruction and the highly useful, actionable clinical skills that I help you build every step of the way. And that's what I'm so excited about. This is what I spend all my time on when I'm not seeing patients.
I know you've been working on this for a long time, and it's so wonderful to see it come together, because I know every time you lecture, people are asking you, how do I learn more? How do I learn more? You're just one person.
Right. So I want to emphasize it's for a broad range of clinicians. It's not about treating cancer, because there's only a small subset of people who want to do that. This is really, do you want to serve this population of people who has no one helping them with the health side of the equation, with a feeling of expertise and skill and confidence, and be able to do it on your own time? And so I felt like, how many weekends are there in a year? I don't want to give up time with my family at home every single weekend to study. So I think that this is a really great way to build your skill.
Awesome. Thank you. I think this is awesome. And you gave some really good clinical pearls right here, with the ashwagandha and the ginseng, and, there's a lot here. One thing you didn't emphasize, and I know is important, is the stress piece. And there's a lot of people who are, but they're eating all these great things and they're taking all these herbs. And that's a real important piece that I'm sure you address in the program, is having.
Well, there's a really wonderful woman who runs the Integrative Cancer Care Center at UCLA, and her name's Ann Coscarelli, and she many years ago began to frame the cancer experience as a post-traumatic stress syndrome kind of an experience, where there's one trauma after another. The first one is the diagnosis, right? Then you get a biopsy, then and so patients really are having one stressor after another, and so it has to be dealt with.
Yeah, absolutely. I agree. Yeah. So we have time for questions.
Yeah,
so we
good.
We can do some questions, and I know there are some. So I'm going to ask you a few that's already come in.
Okay.
And I ask my team if they'll please post it here, and if there's any more. So I see one that says, how do you create a physiology and a plan that dodges a recurrence? So I think you mostly answered that, but if you have anything more.
I can just give some summary high altitude. So my system includes looking at, you should understand the tumor and the kind of cancer the person had. You should understand their risk factors, their lifestyle. And then there are certain blood tests we do to analyze the bioterrain. so that we can, like we did in the patient that I showed you. And then you also want to look at the third layer, which is their macro environment. Is like, what kind of environmental exposures do they have? What's their lifestyle like? Are they in a toxic relationship? So what kind of psychosocial reality do they have? So I have a system of looking at that. We actually have a care planner for clinicians of how do you take a history of somebody with cancer risk or cancer history or in the middle of treatment. So you know all the questions to ask a patient like that. So if a patient comes in and says, I'm fatigued, and you take a good enough history and you found out that they had breast cancer and they had chemotherapy, then they might be having not hypothyroidism or anemia, they might be having the long-term effects of chemo. But how would you know that if you didn't take that kind of history? So that's part of learning how to serve this population. And then from there, you use my system to put together, I have foundation herbs and nutrients, and then the personalized ones. And then you build a plan for the patient.
Yeah, absolutely.
Yeah.
So there's another question. What do you think of the use of Lugol 7% iodine in cancer prevention and recovery?
So everything that I do is highly individualized. So does a patient need iodine in their treatment plan or do they not? That's a highly individualized assessment and decision. There are many breast cancer patients for whom iodine is helpful. So my answer is always, is that the right tool for that patient? And how do you assess that, right? How do you assess
Absolutely. That? Absolutely. I hear that. Okay. That's all the questions. So guys, if this is your opportunity to ask some questions live of Dr. Nalini. So if you have any more questions, go ahead. I see Amy Beth and Grace and who else is on? Mary Agnes and Lynn and Kelty and Doreen. And I have to refresh my page to see the rest.
Where's everybody from? I'm so curious.
Yeah, right in the chat where you're from. Yeah. So we can, I'm going to try to get the chat to show on my screen.
You know, the other thing I like to ask people who are interested enough to show up and make time in a busy life to listen to this is like, what are you most interested in learning about in this territory? You know, what's your burning questions on your front burner, you know?
Yeah. So I would say go ahead and put the little love things in there if you like this, or the big, you know, thumbs up, because let's make Dr. Nalini feel like like she should. She's doing a great job. We have, Kelsey says, I feel like we should be doing a high five. This is so important for our clients in our community. Absolutely. It totally is. And it's like you said, overlooked. And here's another question. Are biopsies safe? Cancer cells can spread if you just take a bit of them. Would it be best to take the full thing, even if unknown? I guess she means like take it out.
All right. So again, any medical decision is about risk versus benefit, right? So you have to always assess that. There's no such thing as zero risk. There's risk if you do the biopsy. There's risk if you don't do the biopsy.
That's right.
So I practice in Los Angeles, where we have some of the most world-class physicians who are hopeful in making those decisions. So if you have a small mass and it's easy to get to, most surgeons will take the whole thing, because why not? Why go in there again? You know, if it's so small, it's not going to create much tissue trauma, even if it was benign and not cancerous. You know that for sure, because you took all of it, right?
Yeah.
And so it depends on the size and where it is. Sometimes a needle biopsy is more helpful. So it is my opinion that having a very specific, certain diagnosis is the best way to figure out what will work on a patient. And I am in no way anti-medicine. Is it possible that some tumor cells will escape when you put a needle in? Yes, but they're already escaping. You have a billion cells there. They're already escaping. So you're not causing something to happen that isn't already happening. And so if you get a certain diagnosis, you have a chance for a very successful outcome. If you're just guessing, you can just do something general.
Right. I hear you. Let's see what else. We had another one. This makes me so sad. Oncologists do drop the patients as soon as their plan ends. My aunt was dropped as soon as her oncologist determined she couldn't help anymore, yet had blocked the family from using nutrition to support her during treatments.
Yeah.
So happy you're talking about this.
Well, let's talk about that a little bit, because I'm privileged to practice in a very liberal, open-minded medical milieu, and that's not true in most parts of the country. So I feel that it serves us very well, if we are going to study this and support patients, is to let oncologists know that we are not interfering. A lot of oncologists say, oh, diet doesn't matter. But what they're thinking is diet doesn't cure cancer, right? Diet doesn't do what chemo does. Of course it doesn't, right? So diet treats the tumor microenvironment, changes the terrain. That's what diet does. Diet helps the patient withstand the stress of their treatment. Diet addresses the fact that advanced cancer patients lose muscle mass and get weak. So there's a lot of things diet is good for. We're not claiming that it does what surgery does or that it does what chemo does. So we have to clarify that when we talk to physicians and say, yeah, we know it doesn't do what you do, but it has benefits. And we feel that supporting the health of a patient will help them through stressful journey. And you have to say the most benign, non-button pushing things to some oncologists, right? But if they start to see that you know your science, you know cancer physiology, you know drug nutrient interactions, they'll go, okay. And then I'll just tell you a little trick. So if I have an oncologist that says, you can't take any herbs, you can't take any supplements, no antioxidants, something like that, then I just tell the oncologist, okay, we're going to just meet the nutritional needs of your patient while they go through treatment. But always I have foundation supplements that are just, the basis of really optimized nutrition. Plus I always have a shake, because cancer patients going through surgeries and chemo and radiation, things that break down tissue, they need adequate protein. And if they don't feel like eating, we need a strategy for their nutrients and their protein and healthy fat intake and their fiber. So I put a shake in as a strategy, right? And so I just throw a lot of things in the shake, and the oncologist really doesn't know what I'm putting in the shake.
Yeah, and what about all that talk that nutrients interfere with chemotherapy?
Some do and some don't. So that's what we learn in the course also. Like, for example, vitamin D doesn't interfere with chemo or radiation or hormonal therapies, right? It doesn't interfere with hardly anything. So also some of the Chinese mushrooms that are so immune modulating and help keep your cell counts up, they don't interfere with most things, but you have to be careful with autoimmune patients with those. So we learn those strategies so that you can demonstrate to an oncologist, your patients do better, right? You don't have to say a word. Your patients do better. They will notice that, right?
Yeah.
They'll notice.
That's great. That's great. Amy Beth, hi. She says such an important conversation. Absolutely. I agree. See what else. I'm going to refresh it again and see if we get any more comments. I'm
really glad people feel this is important.
Oh, it's so important. I mean, it's not, nobody's protected from this, right?
No, we're all at risk just because of the environment, right? I was asked in an interview once, what are the top 3 causes of cancer? And I said, environment. Because that's our equal risk, regardless of our family histories or our life exposures to things. We're all living in this chemical soup now. Right. And so the chemicals in our environment, as you know, interfere with good blood sugar and endocrine function, because those chemicals take the place of other chemicals that are supposed to be in our pathways. Right. And so our immune system can go haywire. The messaging if a cell becomes abnormal and aberrant, it's supposed to self-destruct and go through apoptosis, but cancer cells don't do that. So how do you turn that back on, right? So there's botanicals and nutraceuticals that do that. If you have tumors that are not expressing a tumor suppressor gene, we have herbs that can turn back on some tumor suppressor genes. So when I discovered that that science was with us, present tense, then I thought, wow, we really have some big levers. There's a lot we can do.
Yeah, absolutely. I hear you. I totally hear you. Peggy wants to know, how do we get more information on the cancer course?
So you go to this link that's on the screen, and you'll be taken to the gifts that we have for you, the slides and the offer to hear a clinical pearl. And then you'll also have access to look at the website and see a lot more information about the course. And you can also just contact us at info@aiiore.com, and we'd be happy to answer your questions.
Beautiful. Yeah, Peggy says she's starting to talk to an oncology clinic about a health coach role. She's worried that after only IIN training, and she's a beginner in our training, our INE training, but this is a passion. So can a regular health coach be impactful without a lot of training yet?
I have a health coach in my practice. So she does the non-medical part, right? Yeah. So a lot of patients are overwhelmed when you ask them to change their diet, right? They're overwhelmed when they have to organize their supplements. So even as a beginner, there's a lot you can do for these people. And so when you're treating people with serious illnesses, you want to be respectful of where your knowledge starts and stops, right? Mm-hmm. And so if a patient asks a question for which you have no training, the responsible thing to do is say, that's outside my bandwidth right now. Of course, you'll go learn about it right away. So the next patient you can help. But, and then if you're in a course like mine, you get to ask me what to do. And the next visit you have with that patient, you've got more tools for them.
Absolutely.
And you feel safe, right? You're keeping them safe because you're on solid ground, right?
Yeah, I think this is such a great adjunct to our training because you're getting a lot of the general physiology, anatomy, biochemistry, pathophysiology, and all the nutrient protocols, so they get a really wide range of that and all the hormones. But we don't address cancer except on one of the calls that you did. So Peggy's in our NEPT program, and you can watch Dr. Nalini's program.
This is your external cancer module.
Yeah, that's right. But this is taking it to the next level. There's no way I could put together a 25-hour on cancer unless I started doing major research, because I just
right. And there's nothing like experience, as you well know.
That's right.
So it's great that, you and I have been practicing about the same amount of decades. So there's nothing to have someone to ask if you're new in your practice that just seen it all. It's just great. There's nothing that replaces that. And I kind of really like being an elder. And at the same time, because cancer care is changing so much, it's an ongoing learning curve. So if you will never get bored, I guarantee.
No, I agree with that. I totally do. Absolutely. And I think you mentioned it's if you're new in practice, but I don't agree that that's necessarily the only time when it's important.
You know what? You're right.
That you can come to. We have some people in our program that have been nutritionists for 20 years, but they love having the community and being able to bounce it off each other.
And some of our friends who are some of the top functional medicine docs in this country, Dr. Mark Hyman, for example, Dr. Mark Melnilosino, Dr. Frank Lippman, they're my colleagues and friends. They say, Nalini, I have no idea what to do with these patients. I am sending them to you. But I need help. So I need to train an army of people that can do this. Right. And I actually have half the people in our course are medical doctors, and we have a radiation oncologist in our course. We have an oncologist from India in our course. So it's the advanced clinicians are actually feeling the pain of not being able to address these things or have the tools for health. They were trained in the disease care, right? And they see their patients' needs and they don't have the training to respond. And so it sort of doesn't matter where you are in your journey as a clinician. If you're motivated to serve these patients, you need to have reliable information.
Yeah, absolutely. Absolutely. And I can't wait to dig into it too, because I need that extra to feel more confident about it. So
absolutely.
So I don't see any other questions. Let me just do a refresh again and just make sure that there's no more.
Let me just say one more thing to this person who asked about a coach, because the first questions everyone asks when they walk in the door are, what should I eat and what supplements and herbs can I take? right?
Right.
So those are the first questions. So, you can learn enough to answer those questions in a responsible way. And then you can build on that. If you know a person has a hormonal cancer, then you have to tweak it. If you have a cancer patient who's also a diabetic, or a cancer patient who also has autoimmune disease, then you're going to tweak it, right? Absolutely. And so you have to start with the foundation.
Yeah. And we all have, here's the thing. You only need to be about 3 steps ahead of the person that you're really, right? So the simple things that we take for granted, like to make greens or something that they don't know, and they go, "Wow!" I'm shocked at how many people say, "Wow, I didn't know that. That's so cool. You're so smart." I'm like, right? So we just need to be a few steps ahead, and you stay a few steps, even more steps ahead, as the public gets more and more educated, right? We need to educate ourselves, and there's summits, and you can learn some stuff there, but it's always a superficial approach to a lot of different things. Whereas this is that deep dive. And if you are interested in cancer care, you want to be trained by somebody who has got the 30 years of experience in doing it and is constantly keeping up. So I so appreciate you. I am so excited that you have access to this.
Well, you saw me work so hard for several years to finally get
I know you've been working really hard for it. I would recommend you all must know someone who has cancer, or the coaches that work with people that have cancer, doctors that are oncologists. Forward this, share this Facebook Live with them if you think they're going to benefit. And most people will, whether they're the caregiver of the person who has cancer and they want to find out more about how to get access to practitioners.
That's right. That's a lot of who's searching on the internet, is the significant other or the best friend are trying to help and find good resources. So they should find you, a clinician that knows what they're doing, who's close to home,
Yeah. Okay. So I'm looking to see that. I think that's it. So thank you. The link is up there. And we also put it in our chat. It's the same link. We just put our own shortcut because I can't remember what her link is, and I can remember what mine is. So it's drritamarie.com/go/something Dr. Nalini. So I can remember that. Right? AIO, or I'll spell it wrong, and then
nobody knows what it means.
Yeah. Well, what is it?
Yeah.
American Institute, or American and International Institute?
American Institute of Integrative Oncology Research and Education.
Oh, okay. That's why I won't remember that one, but I will remember my own name, drritamarie.com/go, and your name, Dr. So go there, check it out, at least get the slides here. You'll have a good starting point. Watch this again, listen to this again, share it with your friends and your loved ones and your colleagues. And let's just continue to change the face of healthcare. That's what I'm dedicated to. That's what Dr. Nalini is dedicated to. And that's what all of you are dedicated to. We know our system is broken, and we need to provide more care for people, whether they're pre-cancer, to prevent it, going through cancer treatment, or on the other side of it. We need to be able to provide something that provides them hope and empowerment, that they can take steps to make a difference. And they can. We know they can. So I so appreciate all of you being here. Thank you, Dr. Nalini.
You're welcome.
Adore you. Thank you. Bye-bye.